You see a puddle, a quiet pond. What could possibly be lurking in there? Well, today we're going to talk about a disease that does exactly that. It hides in plain sight. Let's dive into leptospirosis, the hidden danger in water. Okay, so right off the bat, let's just wrap our heads around the scale of this thing. The World Health Organization estimates there are over 1 million severe cases worldwide, every single year. I mean, that's just a massive number for a disease most of us have probably never even heard of, right?
And look, don't go thinking this is some far-flung exotic illness. It's actually classified as a neglected disease. It's septicemic, which is just a fancy way of saying it's a serious blood infection. And the crazy part? It could be hiding right in your local area, in water and soil, especially after a lot of rain or flooding. So yeah, it's a global problem, but it can hit way closer to home than you'd think.
All right, so let's get into it. We're going to pull back the curtain on this dangerous and honestly forgotten disease. What is it? Where does it come from? And why should you even care? Let's find out. Okay, first things first, the basics. What are we dealing with here? Leptospirosis is a blood infection, and it's caused by this little spiral-shaped bacteria. But the really crucial part is that it's a zoonosis. That's a key word you'll hear. All it means is that it's a disease that jumps from animals to us. We're not the intended target. We're kind of the accidental victims here. And this is where it gets really serious. Now, a lot of cases are mild, sure. But for those million-plus severe cases we just talked about, the mortality rate can hit 10%. Think about that. That's 1 in 10 people with a severe case who might not make it. So yeah, we are talking way, way more dangerous than your average flu. So that begs a really important question, right? If you got exposed, how would you even know? There's this silent incubation period, maybe a week or two, and then what? What are the first signs that this thing is taking hold? Well, it hits you like a ton of bricks. It's not subtle. We're talking a sudden, rocketing fever, up to 39, 40 degrees Celsius, with these really intense chills. People describe just awful, widespread muscle and back pain. And then you get this very classic sign, red eyes. On top of all that, you might even see the early signs of meningitis, that really dangerous inflammation around the brain. It's just a full-on aggressive assault on your body. Okay, so where in the world does this nasty bacteria even come from? Let's do a little detective work. Let's trace this thing back to its source. Where is it hiding out? And the answer might actually surprise you. I mean, we all think of rats, right? And yeah, they're the #1 biggest carrier, for sure. But look at this. Our own domestic animals are also a huge source. We're talking dogs, farm animals like cattle and pigs. Even cats and horses can be carrying it. It's not just a rat problem. But here's the real twist in the story. You don't actually have to come into contact with the animal itself. The real danger? It's in their urine. That's what contaminates the water and the soil. And this bacteria is tough. I mean, it can survive for weeks, sometimes months, in damp places like mud, ponds, sewers, you name it. So that brings us to how people actually get it. And there are basically 2 ways. By far the most common way is indirect contact. So think about like swimming in a lake, wading through floodwater, even just walking barefoot where the bacteria can get in through a little cut on your foot. The other way, direct contact, like from an animal bite or handling infected tissues, that's actually a lot rarer. All right, so the intruder is in. The bacteria has breached the defenses. What happens now? Let's follow this thing on its journey through the body and see what kind of chaos it can create.
This timeline breaks it down really nicely. So for the first week or so, the bacteria is just having a party in your bloodstream. That's the septicemic phase. Then around day 7, it starts to settle down and attach itself to certain organs. By day 12, your immune system is finally like, okay, party's over, and starts fighting back. But, and this is a classic sign, around day 15, you can get a second wave of fever, which is actually your body's immune response kicking into high gear. So which organs is it targeting? Well, the bacteria has something called a tropism. It's basically a preference, a favorite place to hang out. And its top 3 spots are the kidneys, the liver, and the meninges. Those are the protective layers around your brain and spinal cord. And that right there is exactly why the severe cases are so devastating. We're talking kidney failure, jaundice from the liver being hit, and meningitis. Now you can see the problem, right? Those early symptoms, high fever, muscle aches, that sounds a lot like the flu, or a dozen other things. So how do doctors figure it out? How do they confirm that, yep, this is leptospirosis and not something else?
Well, it's pretty much a three-step investigation. First, you have the classic detective work, the patient's story. Hey, have you been swimming anywhere unusual? What do you do for work? Looking for those risk factors, like being a farmer or working in sewers. Then comes the physical exam, where they're looking for that specific group of symptoms we talked about. And finally, the smoking gun, lab tests. They'll check your blood, your urine, maybe even spinal fluid to get that definitive proof.
And what's really interesting is that for the diagnosis, timing is everything. It's like trying to hit a moving target. In the first few days, you can catch the bacteria itself in the blood with a PCR test. But a bit later, say after a week, it's better to look for the antibodies your body's making to fight it off. That's called serology. And then even later, around day 15, the bacteria is being flushed out of your system, so you can actually find it in a urine test. Pretty clever, right?
Okay, so the diagnosis is in. Now it's time to fight back. So what's the game plan? How do you treat this thing? And maybe even more important, how do you stop it from ever happening to begin with?
The strategy is basically a two-pronged attack. On one hand, you have to go after the root of the problem, the bacteria itself, and that's where antibiotics come in. But at the exact same time, you have to support the body and manage all the damage the infection has already caused.
And doctors have a whole arsenal of treatments. You've got your antibiotics, of course, like penicillin or doxycycline, but in those really bad cases, the supportive care is absolutely life-saving. We're talking everything from just keeping the patient hydrated, to blood transfusions, dialysis if the kidneys start to fail, all the way up to full-on intensive care.
But you know what they say, an ounce of prevention is worth a pound of cure, and that is so true here. The best way to beat this is to never get it. That means things like rodent control in our communities, protective gear for people in high-risk jobs, and just thinking twice before you jump into that murky pond. And for people who are exposed all the time like sewer workers, there's even a vaccine.
And this quote from our research really just nails it. The measures of prevention are the best means to fight against this infectious disease. It's as simple as that. Being aware and being careful, those are our best weapons.
So I guess the next time you see a flooded street or a quiet little pond, especially after it rains, you'll know there's a whole invisible world teeming in there. Which kind of leaves me with one final question for you. Will you ever look at a simple puddle the same way again?